So we're going to be putting together the Berkeley suction machine. When putting it together, you're going to need a couple of different supplies. You're going to need your canisters, 2 of them. We use primarily our 3/8 inch diameter lids for the canisters, but we also have 1/2 inch diameter lids for larger second trimester procedures. And then you're going to need your tubing with your filter, and you're going to need your connector tubing with your male adapter piece. Now, you're also going to need your tissue trap, and you're going to need the blue caps that come in with the tissue trap. Now, in order to put this together, you need to place your canisters in each of the lids. You're going to connect your 3/8 inch diameter caps onto each of the canisters. And then you're going to connect your filter tubing with the filter closest to the vacuum port down here. It's a little bit of a force, but you can push it in there. And then you're going to connect it to the female port, to the male port of the suction lid. You're going to cover the large tubing, large little port there with a blue cap. Then you're going to take your male tubing end and put it into the 3/8 inch end there, and then connect it to the male end on the second canister. Cover the second suction tubing with another blue lid, and place your tissue trap into the patient port, and this is where you will connect your suction tubing to. Now, when your specimen's collected, you can send the specimen in this with the extra blue caps that come into the bag, or you can rip this off and take the trap out and put the specimen into another cup. Depends on how your facility likes it, but here we do. If you want to adjust the suction, you can always turn this clockwise or counterclockwise to adjust. To turn it on, you'd simply plug it in the back and then flip your switch. If you flip the first switch to the left of you, that will be your regular button suction. If you switch it to the right, it'll be your pedal suction. We have a pedal connected always at the bottom. And sometimes a common problem is if you are connecting and the surgeon is trying to press the pedal, just troubleshoot it and make sure that the button is to the pedal portion. I keep the larger suction tubing, both sizes under here. I always keep them stocked. The smaller tubing goes to the smaller cuvettes, and that's the 3/8 inch. But if you're using for a larger specimen, you'd use the 1/2 inch, and those come with different lids. Instead of using a tissue trap, which does not fit in those, they have a tissue sock attached to the bottom, and that's where your specimen will go. You can take that off, remove the ring, and place the specimen in a container. When you turn it on, you always want to make sure that you're testing the suction and just making sure that it goes all the way to the green here, and always just communicating with your surgeon at what the pressures are. Yeah. That's it.
All supplies kept down in the basement?
Yes, all supplies are kept down into the basement. We keep the small tubings and small cuvettes together, and we keep the large tubings and the large cuvettes together as well. But I will always keep one set of each underneath the suction DNC machine, so that way you can go in and grab what you need and use it.
One more question, Peter. The suction is there a preset suction that when you turn it on, it's at a certain level, or?
When it comes in, it's usually set to the minimum. You can adjust it as you go.
Great. Thank you, Peter.
Thank you.